This can be done through hematopoietic stem cell transplants, chimeric tumor antigen receptor T cell therapy, and other developing therapies. The first form of cancer I would like to talk about is multiple myeloma. It is a disease of the plasma cells that reside in the bone marrow. It is the second most common hematologic malignancy, occurring in 100,000 Americans every year. It starts by uncontrolled replication of plasma cells in the bone marrow. Normal plasma cells would secrete immunoglobulin antibodies that fight infection, but these do not, and because of their crowding, other blood cells are not able to reproduce as easily, and their counts lower, leading to many issues. The reason I have a crab up there is because patients manifest certain features known as crab features. These are symptoms that include hypercalcemia, renal failure, anemia, bone lesions, bone loss, and bone pain. Bone loss occurs in 85% of patients with multiple myeloma. So to show what bone lesions look like, the next image is of a very, very developed case. And these bone lesions normally occur in the skull, ribs, and the spine. This is due to an osteolytic factor. It's a substance secreted by the plasma cells, and it is called osteoclast activating factor. To treat multiple myeloma, a form of stem cell transplant can be used, and that is called an autologous stem cell transplant. This is the most common treatment transplant for multiple myeloma. Autologous transplants are a form of treatment that use both the benefits of chemotherapy and of the immune system. These transplants do not require a donor. Instead, they use the patient's own peripheral blood. The stem cells are collected and then frozen. The patient is then infused with large amounts of chemotherapy. And normally, this much chemo would destroy the bone marrow, but the bone marrow is actually rescued by the patient's original stem cells. A physical recovery takes several weeks, and the immune system recovers within 6 months. The next blood cancer I would like to talk about is acute myeloid leukemia. This is a cancer that originates in the bone marrow as well. It affects white blood cells, specifically myeloid stem cells, leading to an increased production of abnormal myeloid blasts, which are a form of immature white blood cells. What distinguishes AML is that myeloid blasts are normally less than 5% of cells in the marrow, but here they make up for over 20% of cells. They then clone versions of themselves, and that's what leads to them becoming so much in the bone marrow. This causes crowding of normal cells and slows hematopoiesis, which is the process by which all blood cells are produced in the marrow. The term acute itself means that it is severe and fast-growing, and it moves very quickly, and patients might not feel symptoms until all at once, and often say it feels like the flu. They may have low energy, a headache, and can present as pale because of lack of hemoglobin. Yep, okay. A possible treatment for that is allogeneic stem cell transplants. Some patients may do well with conventional chemotherapy alone, but in some cases, patients with high risk or refractory disease may only potentially be cured with an allogeneic stem cell transplant. Allo stem cell transplants are different than auto transplants because two separate individuals are involved, a graft and a host, or a donor and a recipient. It relies on that healthy donor that matches the patient, and the purpose of chemo here is actually conditioning to be used as an immunosuppressive agent to suppress the recipient's immune system so it doesn't reject the donor cells. So it's used to weaken it. But the chemo doesn't do the actual work of killing the cancer cells. That is what the donor cells are doing. So the donor cells are really doing that heavy lifting. The good part that we're looking for is an effect called graft versus leukemia. And this is when the leukemia is taken away. when an allo transplant is able to cure a patient, it is based off of this effect, and that is where T cells from the donor have a tumor surveillance effect and can wipe out residual leukemia cells that would be destined to cause relapse or ongoing leukemia at some point. The donor cells make new bone marrow and an immune system, and the work is done here by the donor T cells, but they are infused at the same time as all of the other donor stem cells. The goal here is long-standing remission, being cancer-free. The side effect we don't want to see as much is graft versus host disease. Alternatively, those donated T cells can sometimes attack the recipient's healthy tissues if they see the foreign markers on the tissue and decide that it should not be there. This is the most looked for effect in allotransplants, and it can be acute or chronic. Acute happens right after the transplant, while chronic can occur 6 months after to the rest of their life. It can be treated by steroids and other medicines, but side effects can impact a patient's quality of life. The last cancer that I would like to discuss is diffuse large B-cell lymphoma, or DLBCL. This makes up for 20 to 30 cases of lymphoma and 5% of all newly diagnosed cancers. With appropriate therapies, almost 70% of patients can reach long-term remission. It can be intermediate or fast-growing, and the majority of patients have advanced stage DLBCL at the time of diagnosis, but staging is slightly different than in solid malignancies. This cancer affects mature B lymphocytes, which normally kill and destroy bacteria. The cancer can be present in both nodal and extranodal sites, differing by patient and severity. Some symptoms that we look for are called B symptoms, and those include fevers, night sweats, and weight loss. The most common symptom is swollen lymph nodes. So a possible treatment for that is called CAR T cell therapy, and this was just approved in 2017 for patients with lymphomas, some forms of leukemias, and multiple myeloma. In 2022, it was approved for use as a second-line treatment for patients with relapsed or refractory DLBCL. In this treatment, the patient's T cells are collected, then genetically modified in a lab to specifically attack cancer cells in the body. The lab adds a receptor onto the T cells that will recognize and bind to the proteins on the surface of cancer cells. These allow the T cells to better see its target. This receptor is called a chimeric antigen receptor, or a CAR. In this manner, immune cells are being used to fight cancer as a functioning, non-diseased body part, but are given extra help to do so. This is what makes this treatment so different from others, is that the immune system is being utilized instead of destroyed. After reinfusion, patients must be watched closely for the effects of the new T cells. So checking back in on Emily, she is now having the cells reinfused weeks after they were collected. This was under intensive medical surveillance due to Emily being the first pediatric patient to receive CAR T cell therapy. Not long after, Emily had a 108-degree fever and difficulty breathing. She was moved to the pediatric ICU and was put on a ventilator. Her parents were informed by the medical team that there was a chance she would not survive. When hope was starting to be lost, doctors noticed in her cytokine charts that she had a large amount of interleukin-6 in her bloodstream. Looking for any interleukin-6 fighting drugs approved by the FDA, they saw tocilizumab as an option, a medicine approved for rheumatoid arthritis. As a last hope, they tried it. We will check back in on her later. So why was Emily having all these issues? This can be mainly due to something called cytokine release syndrome. And this is the most common and looked for side effect of CAR T. 90 to 95% of patients will have at least some grade of CRS. It can start as flu-like symptoms, but may have severe side effects. It involves most of the systems in the body and has many symptoms to look for, as you can see there. Another thing to look for is neurotoxicity. This is when bad effects of chemicals and treatments affect the brain and nervous system. This can appear in other treatments like chemotherapy, but it's talked about a lot when it comes to CAR T. It can be an effect of CRS, as just discussed, or independently. The origin of NT before there is CRS is somewhat unknown and is still being heavily researched. The improvement of treating symptoms from neurotoxicity and cytokine release syndrome will let CAR T become a more available treatment to patients. So checking back in on Emily Whitehead. After receiving tocilizumab, Emily's fevers began to decrease within hours. Her side effects lessened, and that night she was able to leave the ICU. Over the next few weeks, she regained her strength while still living within the hospital. She and her family received the good news in May 2012 that she was cancer-free. And she was discharged 1 month later. Here's Emily today, a freshman at UPenn and 12 years cancer-free. She is not just surviving, but thriving. She scuba dives for fun and is going to a Noah Kahan concert in a few weeks. Success can come in all different forms, and Emily is one of the many people who have amazing stories to tell. So with all this said, we can transition to the concept of survivorship. Survivorship describes a very large concept involving a patient's lifestyle while having cancer and afterwards. A patient is considered a survivor from the moment of diagnosis until the rest of their life. There are over 20 million cancer survivors and will be roughly 30 million by 2040. This is good news because it means that the treatments are working and people are living longer. A crucial term to know while discussing survivorship is quality of life. Now here are some definitions of survivorship by actual people who have had cancer. I'll give you guys a minute to read those. And survivorship can also be, so I interviewed 5 people and conducted a survey with about 20 different people who have had cancer and still have it or are in remission. I asked a variety of questions, and here are some of the responses to what survivorship is. And I also asked surveys to see some statistics of how people looked at different things that they were experiencing, different questions involving quality of life. So would you say that your quality of life improved after your treatment? About 60 people said yes, but that means a big chunk, 40%, said somewhat or no. And cancer treatments are very taxing to the body, to the mind, so quality of life definitely can decrease after cancer treatments, and it's really important to notice that and to talk about that. It's not always all great as soon as treatment is over. Understandably, 90% of people said that cancer changed their outlook on life. The remaining somewhat believed that they had already had a similar experience before, but definitely makes sense. It's a very life-changing thing to hear. Have you found support in a community of cancer patients you didn't know before? I was slightly surprised by this one because I know that many people look to find cancer patient support groups, but also a lot of people find that support just from their family, friends, and caregivers, which makes complete sense. Would you ever try a clinical trial treatment or something that's not approved yet? I just wanted to ask this because of discussing Emily Whitehead and her trying CAR T. It absolutely makes sense that a lot of people are unsure because sometimes you want that security, but About 60% did say yes, and after talking with my on-campus advisor, Mr. Miller, we were thinking, if I were to just interview a bunch of students in class, a lot of them would probably say no, and I think that this really shows like people are willing to try new things. Did you find as much support while you were in remission? There is still a chunk of people that said no, about 12%, and that's because people sometimes assume people are good. Just drop it off, don't bring it up again once they are out of treatment, once the cancer is gone, and it can still affect people very long into life, and that's with any experience really. But luckily, a lot of people did say yes. They felt as much support, which goes to show that, the crew team is doing something right in Dartmouth too, and that people's friends and family are really helping them. This is my favorite graph of all. 90% of people find themselves supporting other cancer patients more than they did previously. And I have a section underneath where people chose to explain some of their answers. And the people that said somewhat or no explained a lot of times it was because they were just more introverted or because they didn't feel like they had bad enough cancer. And I just think like this group of people just really show an amazing community. Do you wish you had a different treatment? 16% of people said yes to this. Your treatment can have such a big effect on quality of life and how your physical body reacts and how much of an effect it has on your mental health. And it's really important to have many conversations with healthcare providers about treatments and about seeing what's best. And then, is quality of life more important than remission or longevity of life? So I just wanted to give 2 quotes while looking at this one because I really think there are so many different perspectives when it comes to something like this, and it's really hard to just choose one or the other, and it shouldn't be a situation where you have to choose. So the 2 quotes that I have is the quality versus quantity of life question is the most difficult question. I had a friend who was in such agony with her treatment. She disconnected it and succumbed within a month. I can see that point of view. On the other hand, I personally didn't mind going through some difficult treatment to come out on the other side with many good years ahead. Another quote that I want to say is, when diagnosed with cancer, my daughter was 3 years old. While my quality of life has been marginally diminished, any changes are not known from the surface, but watching my daughter grow up far outweighs the minimal inconveniences of my treatment. I think those just really show there's such a spectrum of different things that people are going through for why they might choose quality or quantity, and it's different for every single person. So, life with and after cancer. Cancer in itself and cancer treatments affect every single person differently. However, it must be discussed that cancer is very taxing on the body and mind. There are often physical, emotional, and financial stress involved. For example, for financial stress, CAR-T can be up to $1 million to receive as a treatment. Luckily, many hospitals use programs and grants from themselves or from Leukemia and Lymphoma Society and help patients navigate this. Another big thing that is talked about is emotional stress. However, not always after remission. Many people hear the words cancer-free and believe that all is good again, but transition is very difficult for many, along with fear of reoccurrence. Lastly, physical tolls can decrease one's quality of life. Research has found that cancer patients experience increased fatigue even 10 years out from diagnosis compared to their age group. Survivorship has recognized these important aspects, but shows light and positivity to those who want to live life to the fullest. So I conducted 5 interviews with people who have had or do have one of these 3 blood cancers discussed and have had a cellular immunotherapy to treat them. Here are some of the questions that I asked, and I'm just going to read off some of the most memorable quotes that I got from them that I think really sum up most of the answers. I'm just going to drink a little water first. Life changes after diagnosis. I was immediately trapped in a hospital for 30 days, but I made a routine in the hospital and took control over the little things that I could. After diagnosis, it was a whirlwind of trying to get the best medical care possible. All energy was put into finding the best treatment. You have to be strong to begin with, and have faith and will. There are serious dark days, but you can get through it. When you are in the hospital, you have to socialize and learn about the nurses and make connections. It is important to have even follow-through and clear conversations for plans after treatment and being cancer-free to help with stress and transition. Everything is easier with a plan. Survivorship communities help give us a plan. Survivorship is important because cancer patients need to form some kind of community. Survivorship can help get people out of the black hole. Survivorship includes caretakers too. As a spouse, it is traumatic and difficult and hard to be alone in the house. But there is support from staff and many different experiences and perspectives. It was amazing how inclusive they were at Dartmouth, and I even felt a sense of comfort going there to visit. Details and money were challenging, but Dartmouth helped find scholarships. It is important for somebody to be able to advocate. Patients should be able to make the decision about longevity of life versus quality of life. What is best for someone is not best for everyone. Family and friends should get educated on how to support a survivor and also need to give caregivers support as well. Cards and calling mean so much. To be thriving, not just surviving, you have to surround yourself with positive people. Treatments were definitely worth it, but there's some survivor's guilt, but I'm grateful that it's working. The best attitude is being positive. We are going to overcome this. It was hard to transition back to normal because I had tried 3 times already. So after CAR T, I was hesitant, but when I was able to return, it felt like I had finally made it. Thriving is what we want, not just surviving. We hear this from so many different people. You need to be positive to survive. In conclusion, long-lasting remissions are becoming more achievable, partially due to these cellular immunotherapies and their success. This is causing more cancer survivors. There is still work to be done in improving remission rates in the first 6 months post-treatment for all 3 therapies. Cellular immunotherapies have helped oncology develop new forms of treatments that are still in trial and ongoing. Survivorship is crucial to cancer care, and many people have unique stories and opinions that cannot be summed up in one presentation. It is important to do individual research instead of assuming the wants of a large group of people. And I would just like to thank Dr. Hill and all of his amazing help and volunteer time to make this presentation possible. I would like to thank Mr. Fry for dealing with me every day and his help to organize my thoughts throughout this whole process. I would like to thank Mr. Miller, my on-campus advisor. Thank you to Dr. Zakara, my writing advisor, and for giving me so much feedback. I want to give a huge thank you to all of you that did interviews and helped me by completing the survey. I also would like to thank my grandpa for making my experience at Vermont Academy possible. Thank you to all of the friends and family here tonight. And my biggest thank you is to my parents. I don't know if all of you know this, but my mother had DLBCL a few years ago and had CAR T as a treatment. She has sparked my interest and fought so hard to be here today. My parents are my biggest supporters, and I'm so thankful to them. Thank you all so much for coming.
how does the auto cells know to go after cancer cells? Like, is that just like part of their programming?
So in autologous stem cell transplant, it's actually the chemo that's killing most of the cancer.
Okay.
The stem cells that are being reinfused, that's rescuing the bone marrow.
Okay. Thank you.
Yeah.
This is kind of more about the process. How did you manage to sort of separate your own personal experience with cancer, with the research, and try to keep objective and focused on the data and not sort of have that spill over?
I honestly didn't. I just kind of, I think you gotta look at it more like people are people than looking at some stats. I think that it's just different if I'm looking at statistics of different things than this, because no matter what, you can't really separate the person from this. Yeah. Yeah.
Well, first of all, thank you. It was wonderful working with you. But I'm wondering what you think about the possibilities of artificial intelligence and CRISPR and some of these really amazing emerging possibilities and their impact specifically on cancer research.
I think there's a lot of really amazing treatments that are undergoing different research and things that will be out soon, but I have no clue how artificial intelligence will be used for this. I do not understand that, but it's definitely really interesting. Yeah,
How do you get T cells out of the body?
So the T cells come out with the stem cells. They come out together. As for the actual adding the receptors onto them, I'm not sure. That's more of a biomedical question, but they're really it's just through a taking the blood out, I guess. Yeah, Albert.
How long did it take you to do all the research of the topic?
I started this about a year ago. I would say I even had a little bit of a head start on it because my junior AP art project, I actually did a little bit of research on this. But yeah, about a year ago is when I started researching. I developed my proposal and idea last summer, and I have probably spent quite a few hours each week on it since August. Yeah, Mr. Munoz.
God bless APR. The other thing is, what's something you learned that you didn't expect to learn?
Good question.
Oh, that's a good question. I think learning about how important it is to just talk to people and ask them how they're doing, and how that really affects so many different things, and connecting survivorship to more tangible research, I guess. Yeah.
I know immunotherapy is only approved for a handful of different types of cancers. Is there a lot of research going on in the pipeline to bring it forth with other types of cancers?
There's a lot. I actually, I was looking too much into this at the beginning of my paper, and then realized I had to thin it out. But there's a lot of research trying to see how things similar to CAR-T can be used for other cancers, why it can or cannot be used for someday solid tumors, and or even there's a lot of research going on to see if there's some way to manipulate it to be used for breast cancer.
Gave the confidence to take on such a complex topic and be able to present it in this way.
The presenting was easy because the presenting was easy. I've had to perform since I was very little because my mom. And I think the topic, it just really interested me, and I really wanted a challenge. Yeah. Yeah.
Sophia, thank you so much for this presentation and for all your work all year long. After reading your paper, I felt obviously much better informed, but I also felt hopeful because you're on this. And I want to know where you imagine going from here. We know you're going to Amherst College. Congratulations. But I imagine, like many other Capstone students, you're going to take what you've learned here and move forward and continue to provide those of us here with hope. What are your thoughts there?
Yeah, I mean, I really hope to be a pediatric oncologist someday. There's a lot of time for that to possibly change, but right now I'm pre-med and I'm really hopeful to do something in medicine.
How has it been to be a part of the community of friends and family and patients moving forward in this? I mean, you've had exposure to the scientific side of this, but in the midst of all of that, maybe it touches upon the question that was asked earlier about, separating your emotions, but just how sort of unique and just amazing has it been to have people in your midst that have actually lived through the treatments that you're talking about and experienced them, and you've been able to kind of read about it on the research side and then experience it, vicariously through talking to these folks.
Yeah, it's been so helpful to be able to say, oh, well, this happened, like, how did you feel during that? Or, like, what really was this to you? And it's given me so much more insight than I could ever learn from, like, online or from research, and it's helped so much, yeah. All right, there could be no questions, so I think...
Can I say a couple words about you?
Oh, yeah.
I think I can project. So, a year ago, Sophia, who I had met just briefly when Lisa was under our care, and was very impressed, and then she was back at school, and then she contacted me and said, would you consider working with me on this project? And boy, what an amazing journey, and so worthwhile, and an example of when you mentor someone, how so many times you get back so much more than you gave. This is an incredible woman. She's so driven, she's so curious, so humble. And to anyone that says, well, our kids today, they're not committed like we were, or anything like that, this should give us all so much optimism about, what places the world's going to go, and the potential for so many good things. She has so much to offer. And anyway, thank you so much for the experience, and we're so proud of you.
I gotta say one thing. How can this not happen without me saying one thing? Well, first of all, thank you for everyone who's here, because all of you are friends and family, and you've been through the journey, whether you've been at Vermont Academy, in our lives as family and friends at Kern Hatton. This has been a true journey. Her passion and her ability to stay strong through this entire my treatment. Everyone here at Vermont Academy knows how strong and resilient she was. And she still kept a 4.2 cum and played all the sports and did all the music and did everything. It's just truly, truly remarkable. We are beyond proud of her. I am so thankful to be alive. I'm so thankful for this treatment. But greater, I am more thankful that she is going to go out and inspire other people to keep doing what she is doing. So thank you to everyone who's here. You are truly a member of our family, and we're so proud of you.
Sophia, it's been a remarkable journey. Dr. Hill, thank you very much for all your efforts and work. I'm very proud of Sophia, and thank you. Bianconi, thank you very much. The long-term relationship is kind of winding down. It's okay. thank you all for coming. It's been a great journey this year, and we only got a few more days, and then they're no longer in high school. They're going to go off to college and start another journey. Thank you, Sophia.
Thank you.
Thank you.
It's fine, you have no idea that.
Oh, yeah.